Well, officially welcome all to our Maine Rural Healthcare Education Grand Rounds. My name is Dave McClellan. I'm the program manager for the MERGE Collaborative, which is one of the hosting organizations. The other hosting organization is the Building Maine Network, both state-funded grants through the Department of Health and Human Services. And we are just thrilled to invite Kelley Strout today. I'm going to just read briefly some information about Kelley and her background. Make sure I have this here. So Dr. Strout is an associate professor and director of the School of Nursing at University of Maine. She is the principal scientific investigator for 2 Federal Health Resource Service Administration grants focused on diversifying the nursing workforce, transforming nursing education, and promoting resilience. In the past 3 years, she has secured over $5 million in federal funding. Under her leadership, University of Maine Nursing ranked in the top 11% of BSN programs nationwide by US News World Report, and she lives in Bangor with her husband and her 2 sons. We welcome her. And so I'm going to be the one sharing the screen here. Let's get this started. And Kelley, once this is up, the floor is all yours. I'm on view only slideshow. Here we go, and share screen.
Thank you, everyone.
I'm going to turn my camera off.
And also, I am on sabbatical this year, and you know how these things happen very early, months in advance. And so I'm not currently serving as the director. We have a different director, Mayor Tedesco Schneck. So if you have any issues about the School of Nursing, you can notify her. But I'm working on these grants and getting some publications out during my sabbatical this year. So we're really excited that we were able to secure these 2 grants because, as you know, nursing burnout and workforce diversity are critically important right now, not just to our profession, but the healthcare workforce in general. Next slide. And these are your continuing education slide. So I just give you a minute if you need continuing education to text that number and receive your credit.
And folks, I'll put this in the chat towards the end of the meeting as well.
Perfect. So you could click through those 2 if you want. There's some other disclaimers that I do not have any relevant financial relationship with this organization. Okay, so for nursing education, students in nursing have much higher rates of stress compared to other academic majors, and this is over several studies, and particularly in the first year of nursing school, stress predicted 40 to 80% of mental health disorders, and stress in general is significantly high among first-year college students because, major life transitions and adjusting to a new routine. So in the School of Nursing, we have focused on the first year for a lot of these reasons. Next slide. Why are nursing students so stressed? There is, like other health professions program, there's high performance anxiety and progression standards. In our school, if you earn below a C+ on as your final grade in a course, any nursing course, or your exam average is below a C+, you must repeat the course. And if that happens twice, you're dismissed from our program. So these are very high academic progression standards, much higher than any other program in the university. And this creates a lot of pressure for students. Students also struggle because our academic credit to clock hour ratio is not 1-to-1 like it is for most other academic majors. So a nursing student goes to clinical 8 hours a day. They will get 8 hours once a week. They'll receive 1.5 academic credits for that, whereas their peers in other majors would receive 1.5 credits for 1.5 hours in class. There's clinical distress, particularly in our program. Our students are predominantly straight out of high school, and then they're exposed to a range of clinically distressing situations that require maturity instantly when many of their brains are not fully developed. There are high rates of anxiety, depression, and sleep disturbances in nursing students, and we see this in our population, especially since we started measuring it more closely. Also, nursing students have higher ACE scores than their non-nursing peers, which is a lot of the reason why they were motivated to go into nursing in the first place. And COVID has been established as a traumatic experience for adolescents and children. And year over year, we will receive more students in college that have had different effects of COVID depending on where they were when the pandemic hit. Next slide. We know there's a nursing shortage. I really don't need to belabor this point. We talk about it all the time. Of course, burnout and stress and working conditions are cited as reasons why more nurses are leaving the profession. Next slide. What's less talked about is retention rates in nursing school. There's a lot of pressure, especially my 5 years as director. The number one question I'm asked over repeatedly, board of trustees, all the clinical partners, community members, why don't you just increase your enrollment? Why aren't you increasing your enrollment? Why aren't you increasing your enrollment? And you've even seen nursing programs pop up across the state. We're going on 17 nursing programs in our small state of Maine, but we've not really ever talked about retention and why we're not graduating students on time. And the retention rates for 4-year nursing programs, in our program, they're less than 50%. So for us, instead of focusing on expanding beyond our capacity, we really focused on quality and retention as our mechanism and contribution to the nursing shortage. We can graduate more students on time. Next slide. So we have now been told by our accrediting agencies that it is our requirement to graduate nursing students who are competent and resilient. Yet there is inconclusive evidence on how we just might go about that and what interventions are the most effective at managing student stress. So this study, and I'm going to talk more about what we're doing than getting into the study design and everything just to save time. But this is a longitudinal study that's been going on since 2022. And we'll be reporting out on the finality of that next year. Next slide. So when we first received the funding, we collected data on all of our students with valid and reliable measures. We measured burnout using the Oldenburg burnout inventory, and that creates an algorithm to stratify risk scores. I knew students were stressed, but these data really surprised me because what we found is that the students were coming to us already at a high rate of burnout. So first-year students are already at high risk of burnout. We don't help that situation, and then we graduate them and send them off to you, the employer, at a very high rate of burnout. And then we wonder why the first year of nursing retention is so poor across the country. Next slide. We also found the same as what we actually expected to see high rates of perceived stress across our entire population. So these findings were not surprising, but we have very high rates of perceived stress starting in 2022. Next slide. We looked at just some baseline. Okay, we know they're stressed, we know they're burnt out. Is there anything that's already happening that's reducing those rates? And so we did find that on-campus students were more active and significantly less burnt out than off-campus students. So I'll talk more about how we use that to our advantage. Next slide. Okay, so when I submitted this grant, the Notice of Funding Opportunity said that we needed to implement interventions that had significant evidence to support their effectiveness. So we had 3 interventions: fitness, because of the strong science behind physical fitness and mental health; a nutrition intervention to focus on nutrient-dense foods that particularly affect mental health; and mindfulness-based stress reduction was our primary intervention. And this is a major intervention because it requires faculty or staff to undergo significant training to become certified. To be honest, this turnaround time for this grant was 6 weeks, and I was looking at systematic reviews and meta-analyses on mindfulness-based stress reduction, primarily in the healthcare workforce and nursing workforce, and there are hundreds of studies about its effectiveness. And since I've been digging deeper over the past several years in MBSR, there's also a lot of research on this for all types of health conditions. And there's currently an R01 trial out of Brown University, which is our partner, to look at making MBSR a reimbursable health intervention for patients. So the original plan was we're going to implement MBSR and everyone's going to take it. So we were following rapid quality improvement evaluation process. And then I'm going to tell you how this has evolved over time, because let me just share that this didn't work. Because when you tell really stressed people to go do all this extra stuff, they actually get really mad at you and they don't do it. So we had poor attrition, poor signing, poor signups, and actually our students were just getting mad at us for suggesting that they needed to fix their own well-being. So next slide. So what we realized quickly within the first semester is that if we're going to reduce burnout and enhance well-being, we've got to transform our culture. We need to make the environment easy to be healthy and well, and we need to have resources that are accessible to meet the needs of not just students, but also the faculty and staff. Because if your staff are burnt out and unwell, then that negatively affects students, which then negatively affects patients and the whole cycle. So we changed our mindset pretty quickly to a different model. Next slide. Starting with recruitment, we knew that diversity was a significant area of improvement for us. Before these grants, we were admitting nursing students exclusively on the SAT score alone. In our program, we have approximately 1,400 applicants every single year for the past 6-7 years. And because we were admitting only on the SAT score, and Maine high school students tend to perform poorly on SAT as a whole, the majority of our enrollment were represented out-of-state students. Additionally, we had low rates of first-generation college students, or students who are the first in their family to go to college. So we worked on with national consultants an evidence-based holistic admission rubric that's very comprehensive and includes multiple variables, including healthcare experience, which has also helped us help the workforce, because we're admitting more students who are already CNAs, already MAs, already EMTs, so they can work immediately while they're in nursing school. We then worked on our websites, social media presence. We had marketing, branding and visibility, enhanced tours, and what's being cut off at the bottom just in this translation is professionalism, and really upgrading our handbooks, policies, making sure that our students are representing our values and expectations, because they are our brand, so that this would then reflect the students who wanted to apply to our program. Next slide. So over time, we've tracked how these efforts have made an impact on racial and ethnic minority enrollment, and also first-generation student enrollment. To create the baseline, we meaned years 2016 to 20, because 2020 was a very unusual year, and so was 2021. So we didn't want to base it on pre-grant numbers. And as you can see, for racial and ethnic minority enrollment, we were right on par until this year. But this year, really, all the interventions were in place during the recruitment cycle. So, and you can see that it's made an impact on our incoming 2024 cohort. For first generation students, 2021, we didn't have our holistic admission implemented yet. That was just on high school GPA. The first round of holistic admission, we had 41% first generation enrollment. Then 2023 was 35%. This year, unfortunately, because the federal FAFSA, the financial aid package, they changed the process. They actually changed it to help first generation students, but in the end, they were the ones that suffered, because it was a mess if anyone had a kid going to college or a friend of one. And there's reports that up to half of first generation college students never even filled one out. So we don't think that these incoming 2024 first generation college students is actually any fault of what our processes are, but more of a federal issue that we hope will improve next year. Next slide. So we knew students couldn't do anything extra. We have a lot of rules and regulations in our curriculum, both from national and state standards and requirements. So what we did is decided, okay, we're going to start upstream, and we're going to bring all nursing students to campus a week early. And we're going to implement our interventions here, give them these tools, and then thread them through our program. Next slide. So we bring students to campus. All the housing and meals are covered. They live on campus. It's a 6-day curriculum. It involves mindfulness, yoga, belonging activities, student success, physical activity, and nutrition. And it's all centered around a research study of their own health. So they create a research question. They're all given Fitbits. They track their research question outcomes, both quantitatively and qualitatively, with qualitative research questions. And then they're enrolled in a 1-credit class at the end of that week that they take throughout their whole first semester that gives them booster doses of every intervention each week. And then at the end, they write a lab report about their own health and well-being. Next slide. Introduction to mindfulness is the curriculum we're using, not mindfulness-based stress reduction, because upon training through the MBSR curriculum, we learned about the trauma, the adverse effects of trauma and mindfulness, and other contraindications to MBSR depending on the clinical situation the student's in, especially not being able to assure that the student had a psychotherapy component if required. In trauma-informed mindfulness, one of the recommendations is that you don't engage in any meditation beyond 15 minutes. So this curriculum, there are no mindfulness practices or meditations beyond 15 minutes. So that's why we chose this curriculum. Then we'll offer mindfulness-based stress reduction as a course, as an elective, if students choose to do it later in the curriculum. And then they'll kind of have an idea too of what they've signed up for. Next slide. Half the class, they're all broken into small groups throughout the week, and they rotate through all these sessions. We have a mindful fitness program that was developed by a clinical psychology student. It's based on evidence related to mindfulness and fitness. And the other awesome part about this is it exposes them to the different physical fitness opportunities we have on campus: the pool, the gardens, the trails, the climbing wall. And it's been a really successful program for our students. Next slide. This is just more about, everything I just said, but this is the danger of not controlling your own slides. Next slide. We also have a mindful nutrition program, which is teaches students about nutrient-dense foods and mindful eating. It's not a diet. It's not about weight loss. It's focused on improving diet quality, and it's also centered in a cooking competition. So they receive food items, and then they design recipes, and they compete with each other. Then they're all provided a cookbook that's dorm style for meals that they can make in their own dorms. And then all these curriculums are then weaved into our 1-credit course that we offer in the fall. Next slide. Everybody takes yoga. There's a lot of research on yoga and its benefits to stress response. So we have yoga embedded as part of this program. Next slide. We have a session on connection and belonging, and the student's academic advisor and student success coordinator has them, they all write down something they're scared about or nervous on a piece of paper. This is like one of the activities, and they crumple it up and they put it in the middle of the table. And then the advisor reads them all unanimously. And what comes out is that they're all feeling very similar, but worried that they're the only one feeling that way. And we try to instill in them from the gate that social connectedness is your number one peer support. This is what's going to help the most with resilience and getting through tough times in the rigor of our curriculum. And what's been really powerful is last year, and I'll just give you an example of the community that we're trying to build. Last year, during the Lewiston shootings, it was really jarring for students on campus. So many of our students had a personal connection in one way or the other. And they were also enrolled in this Anywhere 150 course. So we were receiving weekly reflections from the students. And the students wrote about how when the campus closed on Thursday, they sat together in the common room of the dorm and they meditated together during that experience. And that, I could get teared up thinking about it, but that's exactly what we're trying to instill, is this from within culture, community, that they have a lot of tools they can draw from, but it's more normed to be well together, especially during acute situations. Next slide. We also go over, how to be a successful college student. I presented this to some people at the Maine Hospital Association this week, and there was some concern like that maybe we reduce rigor, or maybe we're setting up an unrealistic expectation of the workforce, which I can understand those arguments, but we have not decreased rigor. In fact, in many areas, we've had to increase rigor because of new accreditation standards, et cetera. So we do put them through college success. We work with them on time management. These are planners we give them to help them be very organized so that they don't fall behind. Next slide. We work on destigmatizing mental health needs. One of the data points that we found through our very comprehensive data analyses is that students who are falling behind because of test scores, when we interviewed them and learned more about them, we found out that about 90% of them had accommodations in high school. So they had a learning disability and they had different accommodations, but they were told that to be a nurse, you can't have accommodations. Their guidance counselor encouraged them against it. And we want to destigmatize that rapidly. So we've actually been taking students over to accessibility services, strongly encouraging them, because we have success stories of students who had that belief, then went and got their accommodations in place and are actually straight A students feeling very confident about their future. So we really want to destigmatize any mental health need, regardless of what it is. And part of that is just knowing where to go for help, and also saying that we support you getting the help that you need to be successful. Next slide. I don't have time to go through all of this, but this is just all the things that we're doing to make sure that once we recruit students who are diverse, and we armor them with all of these resources to address their response to stress, that we are then not inadvertently creating stress on the back end with our old systems. So we have done a lot of work creating a 5-year strategic plan with all stakeholders. We have well-being as a strategic initiative, along with a lot of other really important clinical requirements, including a PhD program in nursing, so we can fund our faculty, so we can staff our faculty shortage. We expanded our living learning community because of the health benefits of living on campus. So now all first-year students can live in the community. We also offer an accelerated CNA training with Northern Light Health on May and winter terms, so that students, we actually have an extended stay dorm so they can live on campus while they take that 3-week certified CNA training. We have implemented peer mentoring, so it's not like, oh, you're feeling stressed, Kelley, here's a peer mentor service, go find that for yourself. All first-year students and senior students are paired in peer mentoring, and it's a required assignment with multiple checkpoints, so everyone's getting it. We created a wellness room. We have community and team building, so we decided we weren't going to recreate the wheel. So we took activities that were already happening on campus. We have 2 5K, well, one's a 5K and one's a 4.2K. In the fall, one in the fall and one in the spring. So the campus advertises it. What we do is we pay for it. So we pay the race fee, which is $12 a student. And what we learned after, doing that is it would be even more accessible if we also paid the race fee for their children or their spouse or their family. So we do that now. And we've had between, 110 and 150 students and faculty and staff in the whole community show up for these events. And they're really fun. We offer mindfulness and a mindfulness-based stress reduction as a course. We've had so much continuing education, not only in DEI and resilience, but also in how to design teach an effective course. which has resulted in curriculum transformation. And I will say that this is what happens at point of care, wherever your point of care is, ours is faculty to students. It has been the most important variable in the whole equation. Next slide. Okay, so mindfulness-based stress reduction, I won't go into it too much, but it is an 8-week, 2.5 hour per week with a 1 full day silent retreat program. There are hundreds of high quality studies to support the benefits of MBSR on stress response, emotional well-being, and many other health interventions. This has been approved now. It's developed as a credit forbearing course. Students can take it as their artistic and creative expression general elective requirement. Next slide. Whoops, that kind of got distorted. There are practices in this course that are not, like, I think sometimes it gets a stigma as it's just meditation. It's not. There's communication skills, being aware of your body, enhancing compassion, mindfulness. It's a very comprehensive program if you've never taken it before. Next slide. And oops. Anyway,
sorry about that. It's coming up, so hold on.
That's okay. I can keep going. It's fine. What's been interesting about MBSR, the more that I've been teaching it actually, is how much it integrates with health profession competencies, patient-centered care, compassion, teamwork, cultural humility. You know, it's like we think we can teach compassion by like reading about it in a book, but these practices actually help build compassion from within. And it's tough to even describe it without trying it out because otherwise I sound a little silly. So I am going to invite you to a program that we're running that we're going to offer free to charge for any healthcare professionals in the state. So you can kind of see what I'm talking about. It's the more and more I teach the course and just see all the intersections, the more I believe that it's essential for healthcare workers to have training in mindfulness and MBSR, but if anything, just mindfulness. Next slide. Next slide, we'll skip this. Okay, so what have we found? Next slide. We've offered several MBSR courses. This is a group of students who were taking the course in the winter. We've had decent enrollment, even though this is not required. This is counting as a gen ed requirement. Next slide. We have found statistically significant reductions in perceived stress, increases in satisfaction with life, and increase in mindfulness skills from students who have completed MBSR. And faculty. We have other analyses for faculty and staff as well. Next slide. These are just some of the comments. This is from the spring course. A student said, I haven't puked from stress in 2 months. This is the longest I've gone since 2016. I'm not having as many tension headaches and don't feel anywhere near as out of control. I used to struggle with agoraphobia and I couldn't leave my apartment after dark. Now I don't even think about that. So this class for so many has been life-changing. Next slide. These are other comments, like they signed up for it because they needed the credits. Now they realize it's a tool that can help them. They've been able to rethink their anxiety and notice that these are thoughts and they don't necessarily have to react to them. Students' response to stress has been one of the biggest takeaways of all of our qualitative analyses. Next slide. And then this is the other slide I just wanted to highlight earlier when I said we're admitting all of a significant increase in first generation college students, and people might think, oh, well, how's that affecting your retention? Well, we admit them, but we also fund them. So they don't get full funding, but they receive about on average $5,000. That's it. And as you can see, so the first year we did it, the first generation college students were retained at 83% with funding. And those who are not first generation at 77%. The next year, you know, as our interventions and we're making our program more stable, the next year it was 92% for first generation students and 83%. And I don't get the retention reports until October of the year after. So I'm now waiting for this last year's, which I'll get next month. So when we really cry out about nursing students and needing nursing students, we need to put our money where our mouth is. Students need money. And there's very little money for nursing students. They're just expected to go to nursing school and then work and fund themselves to solve this societal workforce gap. And we need more funding for nursing students. Next slide. Okay, so for our first year Bridge Week, we looked at perceived stress at the beginning, before they started the program, immediately when it ended, and then at the very end of the semester. And we collect the data right before finals week. And we actually found that we had a statistically significant reduction in stress scores overall, but also those students who progressed on to the next semester were less stressed than those who didn't, which isn't that surprising. But what's kind of interesting about it is just the dramatic shift in how their perceived stress was immediately after. It's like they had no stress. You know how they say like a little bit of stress is good? It's like the students who didn't progress didn't have the same level of little like healthy stress, perhaps. We're looking into this further. Next slide. We found the same outcomes with burnout. So we did see statistically significant higher rates of burnout for students who didn't progress, which is not as surprising, but we did see a significant decrease in mean burnout scores from before our program to the end of the semester, which is not what you see in typical first-year students. You typically see that they're more burnt out and more stressed at the end. So these are promising findings that we can, in fact, move the needle on this. Next slide. These were other findings. We did increase satisfaction with life, increasing mindfulness skills, and mindful eating. Next slide. And next slide. So we are looking to expand MBSR. We're also going to begin a focus groups with our students at each semester in our program to determine if there are more inadvertent causes of unnecessary stress that we haven't thought of. You know, the schedule, the 3-hour course, the scaffolding of the curriculum, who knows, whatever we're going to learn, and try to see if we can reduce more systemic barriers to stress and well-being. We're also going to conduct a thematic analysis of the wellness reports all the students completed last fall, because anecdotally, there's a lot that the campus environment could do to promote well-being. So we want to learn more about that. And then we're going to collect our longitudinal analyses of just our cultural effect on stress and burnout over the years. There's also many other sub-analyses going on about the mindful chef, mindful eating, and mindful nutrition curriculum, because those are 2 doctoral students who have developed and led those analyses. So those will be forthcoming as well. Next slide. Okay, so in the national recommendations from American Hospital Association, the Surgeon General, the National Healthcare Workforce Wellbeing, and other groups, these are some of the common themes for the workforce. Make this a priority and measure it. And what I've learned is we could move the needle on it, because I also had like the supervisory authority. So it's like you can't just hire someone and put them over here and think it's going to solve the problem, at least in my experience. And this is what the national organizations are also saying. So I really support that recommendation through my lived experience with this. Fixing broken systems. We had a lot of broken systems in education. I'm sure that you understand that and see it. And so we're working to fix those broken systems. You know, like admitting students on an SAT score alone is a broken system. Collaborating with staff and listening. This is a big one, because sometimes with students, we think we know best, but we really need to work and partner with them, just like we need to partner with staff and faculty and healthcare workers. And then another takeaway that we've really experienced is the interventions need to be easy to implement and access, and really focus on building community and connection, because that in itself is a really powerful tool to resilience and burnout. Next slide. And this is your continuing education claim. Also, I'll be communicating with David. He's going to send you, we partner with Brown University, and they're going to be providing a 8-week, 1 hour per week mindfulness program that's offered on Zoom. But we want to ask people who are interested in participating, would it be better to do it first thing in the morning, at lunch? So you'll receive an email about that, and it'll be free of charge. And we're putting it out to all the healthcare workers in the state. So we hope that people will participate and take advantage of the opportunity. And I know I went over a little bit, and I apologize. And are there any questions?
And I'll invite everyone to turn your cameras on for the Q&A session. Thank you, Kelley, for that wonderful presentation. And sorry for any technical errors there.
No, that's fine.
Yeah, we welcome, we definitely want to take at least 10, 12 minutes here to answer any questions folks may have. I also welcome reflections. I recognize, oh, here, Deborah.
Wonderful work, and I'm all in favor of anything you can do to get our young learners through their nursing program, because they are so desperately needed. And I can imagine that this applies to just not nursing, but anybody else entering their academic environment and needing to succeed to enable to accomplish that. When you were implementing this, what would you have said is the largest hurdle you had to overcome? Because I'm from a different generation, and there's the generational differences, and I'm thinking of myself going through this, which wasn't available when I went through my nursing program. I just picture myself being more stressed having to do this. And we do have a nurse residency program at Maine Health, and a lot of our new grads having to do that causes them stress.
Yeah. That's where I was saying about making it seem like not an extra thing. And for the most part, coming to campus a week early, and I don't know if orientation is part of that for you, but that reduced a lot of complaints because they saw that as kind of fun. There's a win-win because they could make friends. We did have some pushback on you have to come a week early, but for the most part, people were really excited about that. And everything else that we offer is just part of their day. Like we're not asking them to show up at a different time. We're not asking them to do anything extra. It's just part of the culture. But when we were in the middle of this, I got really discouraged because I had this grand, like, wellness is a big passion of mine. And I was so excited about this. And the first round, we had like 4 students show up to anything. Some programs we were offering, we had nobody show up. And I was very depressed because I was like, oh, I'm so excited. No one cares. But that wasn't really what the problem was. The problem was they're really busy and so stressed they didn't have time to do that. So once it was more integrated, it was much better received, much better received.
I encourage questions, but as I was saying earlier, it would be interesting to hear reflections from the different fields that we have represented in our audience. Kelley's talked to us through a framework of nursing in a nursing school setting, but I would be curious if there are similar structural challenges that need to be broken, walls that need to come down in different areas, or if there's any takeaways from what Kelley has said, how it applies to different fields. Oh, Paul.
Hi, good afternoon. Great presentation. I really do appreciate your thoughts on mindfulness in the educational level. Have you done any work on, is that translated into the professional, and any research on that, and how we can kind of continue that? My background is I was a paramedic that are now working in a critical access rural community, and how do I keep that going? And also share my mindfulness experience. It's kind of funny. I'm also of a little older generation, but they joke about me doing yoga in the morning. But that's a way I'm trying to share with these people to try and, kind of like keep yourself a little mindfulness through your day. So I was wondering, the research on the professional nurses that have gone on to work, and is it translated into a better performance there?
I had that same question earlier this week, and that would be the next phase, the next round of funding. We pulled mindfulness from research from the healthcare workforce and implemented it into education. So we went backward with it, but now we have to see does this make an effect on the product we're producing for you all? And I suspect, and this is what, another hospital president said this week, like the next round of this really needs to involve the healthcare workforce, because we have a lot of work to do on that transition. And, there's just a lot of work to do in general on the culture. And like you said, like people may be teasing you for doing yoga, but we have a lot more control of our stress than we believe. We really can control what we can take in. We can control our time we can set limits on our cell phones. We can not be on social media. I mean, there's all these things we can do, but sometimes in our fast-paced society, we don't realize how much control we have. And I think that mindfulness is a mechanism to regain that control. Even when it comes to advocating, a lot of times stressed out people just start yelling about the situation and it's not effective. So we've even found that when students are advocating for themselves, they're much more articulate because they can they're not emotionally reactive. They're more pragmatic and wise. And I see how that could really benefit the nursing profession as a whole, and probably other disciplines, but in particular, with lateral violence and all these things we see. So it's not easy. This is not easy work. I'm not trying to say it is.
Thank you, and look forward to that survey from Brown. That looks a very interesting course.
Thank you.
You have time for at least one more question. Okay. Oh, there we go, Nika.
Kelley, thank you so much for coming to speak and to present all the incredibly important work that you're doing. This mine is not a question. I've heard you present before, and I'm just so excited for this work. I'm going to reflect back. The two things that struck me the most in your presentation was really teaching and helping young people, in their careers, develop coping skills and practicing coping skills. And the second part is structural changes in the learning environment. And I think regardless of where you work, better coping skills are always a good thing, but also really thinking about structural changes. And it seems like in your presentation was very important for success.
Yeah, we were getting feedback like you care about stress, but faculty are giving me 3 exams in one day. You don't care about stress. So it's once you go out and say you care about it, you got to really care about it, because they're right. So we're like, oh boy. So I mean, we went through our complex schedules and tried to change the way the exam structures and what days they're offered on, because like you said, like if you really believe in it, then you got to really believe in it. You can't think it's just someone else's problem. The other main takeaway is that I went to an education visioning session on Tuesday for K-12, and I was sitting at a table with a kindergarten teacher, a high school teacher, a 5th grade teacher, and then myself, and we're all talking about the same problem, emotional dysregulation. It's starting in infancy, and then we inherit it in college. And so there's been a lot of talk like, well, it's not your problem. Like, this is not education's problem, but if we really care about our workforces and our future, it's got to be our problem. Like somewhere along the line, someone has to put the stake in the ground and say, all right, this has to become our problem. And I know that's not how it used to be, but that's the reality. And we've accepted that in the school because students, the mental health crisis is real. And the rates of adolescent suicide is increasing. Maine has the highest rate of childhood anxiety in the country. And we also have the highest rate of kids in foster care. So our population needs help. And it's a lot. It's overwhelming, but I do think with listening to people and working with people and just making it a priority, you're going to mess it up, but we can make a difference in this area. This is not unachievable.
That is an outstanding call to action. to really put a cap on this wonderful presentation. So Kelley, thank you for everything. Folks, if there are follow-up questions, hopefully you know how to reach us. If you reach out to me, I can get you in touch with Kelley with any follow-up. And I always take this moment, I will actually be promoting through our iHELP-Maine email listserv some opportunities that Kelley is researching for. And did you want to talk about that all, Kelley, before we wrap up some of the upcoming opportunities you wanted to promote?
Oh, yes. I mentioned I'll be sending,
You did. Yep.
Deb will be sending you the Brown. And it may be good just to even have your leadership team within each of your subgroups try it first. You could try that too if you don't want to promote something you don't even know what you've got yourself into. That's how we started. So
stay tuned, folks. I'll make sure everyone who was in this meeting, I should have your email addresses just through the Teams format. I'll try to include you on that iHELP-Maine listserv so you can see some of that information coming out. And next month, I always like to take a moment to promote our next presentation. It's going to be about supporting supporting healthcare learners with disabilities. And it's being presented by Dr. Bethany Picker from Central Maine Medical Center. She's the program director of the family medicine residency over there. So really excited for that. I hope you'll continue to join us for the Grand Round series. And with that, I will thank everybody and I'll end the recording.